With growing language diversity, you may encounter a person with limited English proficiency in your practice. Language can be a barrier to healthcare, and even though it may seem convenient to use family to interpret a conversation, a professional interpreter should always be used in medical situations. Family support and involvement is very important to a patient's care, but using them to interpret can leave important things getting lost in translation. A family member may speak English well, but may not be fluent in the non-English language. Even if a family member is fluent in both languages, they may not interpret everything correctly, may omit key information, or may direct a patient's response unintentionally. Professional interpreters are trained to convey all aspects of a message, including content, meaning, and tone. This reduces errors, improves clinical outcomes, ensures patient confidentiality, as well as increases satisfaction with care. Interpreting services are available to all BC primary healthcare providers and can be accessed over the phone within minutes. BC providers who use telephone interpreting in their offices report it to be timely, helpful, and reasonable to use even on a busy day. To access an interpreter, refer to the toll-free number and access code provided by the Provincial Language Service. Step 1. Dial the toll-free number. Step 2. Select the language that your patient speaks. Step 3. Enter your access code and press the pound key. Step 4. Say your first and last name. Use the speakerphone if the patient is in the room with you. If the patient is not with you, use the conference function to include them. Step 5. You'll be connected to an interpreter who will identify themselves and ask the purpose of the call. Introduce yourself and begin speaking to the patient. Announce the end of the call when finished. When communicating through an interpreter, remember these following tips. Clarify roles and responsibilities at the beginning of the session. Introduce yourself and explain your relationship to the patient. Have the interpreter introduce themselves and explain their role to the patient. Speak to the patient as you normally would, rather than speaking only to the interpreter. Allow time for the interpreter to translate. Say 2 or 3 sentences, then pause. Elaborate and be descriptive when giving directions to the patient to provide clear and thorough instructions to the patient. Finally, ask questions to ensure the patient understands what was communicated. An interpreter does not diminish the role of family in an appointment. As providers, we can use interpreters to support equitable and ethical care for all patients and allow the family to focus on supporting the patient through their illness rather than having to ensure effective and accurate communication.